I am Dr. Jaidesh Kumar Kankuntla, Senior Consultant Physician, Continental Hospitals, Hyderabad. We, in our day-to-day practice, see various types of non-communicable diseases like diabetes, hypertension, thyroid disorders. Hypertension is one of the leading cause of brain and heart diseases. Hypertension or high blood pressure is a leading cause in India, and WHO estimates India is going to be the world capital of hypertension by 2025. Anybody who is having blood pressure of less than 120 by 80 millimeters of mercury is called as normal blood pressure, and there are various stages of blood pressure called as pre-hypertension, where the systolic blood pressure is 121 by 139 millimeters of mercury and diastolic blood pressure is 81 by 99 millimeters of mercury. Stage 1 hypertension is where the blood pressure is more than 140 to 159 millimeters of systolic blood pressure and 99 to 100 millimeters of mercury of diastolic blood pressure. Stage 2 blood pressure is where the systolic blood pressure is more than 160 millimeters of mercury and diastolic blood pressure is more than 100 millimeters of mercury. There is another condition called as hypertensive crisis, where blood pressure is more than 180 by 100 millimeters of mercury, and hypertensive malignant hypertension, where the blood pressure is more than 180 by 100 with end organ damage affecting eyes, heart, brain, kidneys and various organs in our body. So said this, hypertension is one of the leading cause of brain and heart problems. One should know the various symptoms with which this hypertension is presented. Said that many people are unaware of having hypertension in them. As per the WHO estimation of more than 49% of our population who are having hypertension, among them less than 50% of the people only are known that they have hypertension, and among those who know hypertension, less than 50% of them are under control. And this hypertension has to be treated to prevent the deadly complications of brain, heart and kidney diseases. The main symptoms of hypertension are headache, dizziness, giddiness, chest palpitations, abnormal heartbeats, blurred vision, loss of consciousness because of complications, sudden heart attacks and anxiety, etc. With these symptoms, many people present to our OPD on examination, we found them to be having hypertension. Many people also present to our OPD without typical symptoms of hypertension, and on examination we do find them to be having increased blood pressure and we advise them necessary management. And many people reach to our emergencies with complications, and before complications with elevated blood pressure, for whom they don't know that they were having hypertension before that. So this is the first time that they are aware of having high blood pressures, and by the time they know it, already they have developed complications. So in this way, hypertension presents in various people as symptoms, symptomless, and many people present to emergencies because of abnormal high blood pressures. This hypertension are having various causes. The two main causes of hypertension are present. They are primary hypertension or essential hypertension and secondary hypertension. In primary hypertension or essential hypertension, we generally don't find any abnormal findings in our body. Blood investigations or physical examinations, blood investigations or any investigations are not abnormal. Underlying cause is not detected. Such type of hypertension is called as primary or essential hypertension, which usually develops with increasing age. Secondary causes of hypertension is hypertension where there is an underlying disease is detected. Most common cause of secondary hypertension or kidney problems, we call them as renal arterial stenosis, where the blood circulation to the kidneys is reduced. Secondly, renal parenchymal diseases like the kidney tissue is damaged and various diseases are present called as nephritic syndrome and nephrotic syndrome. This is the condition where there will be swelling in the face, swelling in the legs with decreased urine output, and there is loss of proteins in the body also. Like that, kidney tissue damage is one major cause for hypertension, where we identify these diseases by doing kidney biopsy and other blood investigations. Next to the kidney diseases, other major causes of secondary hypertension are endocrine diseases, and among these endocrine diseases, hyperaldosteronism, Cushing's syndrome, pheochromocytoma, hyperthyroidism, are the major causes of hypertension. Like this, various underlying causes are causing hypertension, and without underlying cause also hypertension has been seen. So whatever is the cause, we have to control the hypertension, and we need to identify the cause to better treatment of hypertension. Major complications of hypertension are seen in the brain, heart and kidney diseases. Mainly the people present with brain strokes, bleeding inside the brain because of the rupture of the blood vessels. So this rupture of the blood vessels will happen where there is a blood vessel which is weak, or because of the very high blood pressure, and very people will have small swellings in the brain called as aneurysms. When blood pressure is increased, these aneurysms rupture and bleeding happens inside the brain, and that's where they present to our emergencies with a stroke called as hemiplegia, where they may speech will be reduced, movement of upper limb or lower limbs will be reduced, and they are unable to control their urine, and they will unable to walk. So this is the one of the major presentation to our emergencies as a complication of hypertension, the brain stroke, because of the bleeding inside the brain. They can also be brain strokes with blood clots also inside the brain who reach to our emergencies. And the second major organ that is affected with because of hypertension is the heart, where there will be heart attacks will be seen, sudden cardiac arrest also will be seen, sudden cardiac deaths are also seen because of uncontrolled hypertension. The blood vessels becomes obstructed and hypertension is seen. And heart failure is another major complication, and abnormal heartbeats are also seen because of uncontrolled hypertension. Coming to the kidney problems, kidney disease itself causes hypertension, and hypertension also further damages the kidney, and because of damage to the kidney, urine output will be reduced, waste materials cannot be excreted from the kidney, urea, uric acid, creatinine are accumulated in the body, various acids are accumulated in the body, breathlessness will be developed, and these people will be needing dialysis to treat this disease and various medications to control their hypertension. Apart from this hypertension can also affect the blood vessels in the legs and hands, in the eyes called as hypertensive retinopathy, where blood vessels will rupture inside the eyes and there will be loss of vision, blurred vision will be there, and which is irreversible damage. Unless we control the blood pressure, this cannot be curable. In this way, there are various complications are present because of the hypertension. Because of this various deadly complications, we have to control our blood pressure, and we have to keep it as much normal as possible irrespective of the age. So in the persuasion, there is major management of hypertension, lifestyle modification, and then pharmacological medications and surgical interventions are also present. In the lifestyle modifications, most important part is salt reduction in the diet is most important. We should not top our diet with excess salt, and we should follow less than 2 grams of salt per day is very important. Usage of unsaturated fatty acids, unsaturated oils is also very important in our diet. We have to prevent usage of saturated fatty acids, saturated oils in our diet. Increase in fruit diet is very much useful in preventing hypertension, and doing regular exercise 150 minutes per week of moderate to severe exercise is needed to keep ourselves active, keep our blood circulation flowing well, and preventing our hypertension. Reducing our stress is a very important, and controlling we reduce our stress by doing regular yoga, meditation, and controlling our various financial stresses, and keeping ourselves cool and calm in various situations helps us in controlling our blood pressure. So apart from this lifestyle modifications, we have to, if blood pressure is not under control, we have to resort to the medications as per your underlying condition. If it is a primary hypertension without any underlying cause and your heart rate is normal, one type of blood pressure reducing medications can be given. If your heart rate is more, another type of blood pressure controlling along with heart rate controlling medications will be given. If there are underlying kidney diseases are present, we modify our drugs to prevent further kidney damage, and then we give medications which can prevent your hypertension. If we identify the secondary causes in our evaluation, we treat the secondary cause, we treat the renal parenchymal diseases, we treat the renal arterial stenosis, we treat the various endocrinal disorders like pheochromocytoma, hyperaldosteronism, Cushing syndrome, and hyperthyroidism. We treat these underlying secondary causes. By treating the secondary causes, we control the hypertension. In this way, in the management of hypertension, evaluation is very important point. Identifying the cause of hypertension is very important, and after knowing the cause of the hypertension, we give appropriate medication to treat the underlying hypertension. After medications, if at all still people is not having a controlled blood pressure, there are few surgeries that are possible to cure the hypertension. There are various surgeries which can be useful in controlling hypertension. So it is very much important to keep your blood pressure under control to prevent all the complications. And in this persuasion, everybody should be aware of what are the major symptoms of hypertension, causes of hypertension, and many people should regularly check their blood pressure using electronic BP apparatus at home and keep them blood pressure under control. And once if your blood pressure is seen more than the values that I have seen in the stages of pre-hypertension, stage 1 hypertension, stage 2 hypertension, or in hypertensive crisis, please do approach to us in the Continental hospitals. We, the team of physicians, are here to treat it in a better way, in a scientific way, and the way in which the blood pressure is under control without any complications. Thank you.